afternoon. I'm Heidi Holste, Director of Government Affairs for Care Providers of Minnesota, and today is your Inside Scoop. First, we want to cover March on the Capitol. Mark your calendars for March 11th or March 19th to come down to the Capitol, attend your region rolling days at the Capitol, and lobby your legislators directly. The schedule will be as follows. At 10:30 in the morning at the Kelly Inn, which is right next to the state capitol. At 10:30 in the morning, Patty Cohen, President and CEO of Care Providers of Minnesota, will be welcoming everybody. And then at 10:35 or so, Heidi Holste, me, and Toby Pearson, Vice President of Advocacy, will provide a briefing about where our issues stand at that time at the legislative session. And then at 11:30 a.m., we've invited legislative leadership to come and talk to you, the attendees at March on the Capitol, about how they see things happening at the state capitol and where our issues fit into the priorities of legislative leadership. And then at 12:15, we will have a free lunch. You get it if you show up, so it's free. And then at 1 o'clock, we'll depart for the Capitol and attend meetings with your legislators or committee hearings if they're happening at that time. This week, we have posted a number of different documents to our website. One of them is a messaging document that you can access on our website. Basically, the messages that we're using this session to talk with legislators about here at the state capitol, as well as locally for you all. We've been using fact cards for a couple of years for legislators, and here's an example of one of them that has been updated, and these are posted on the website as well. And then there's also a letter, an advocacy engagement made easy, a draft letter for you to be able to access to contact your legislators as a draft. Please personalize it if you can, and ask your staff to send letters. If legislators don't hear from you, they won't know what your needs are. So please do contact your legislators. We are working with a new PR firm, public relations firm this session called Weber Johnson, and we have identified with them a number of targeted legislative districts where we feel that these people are important in advocating on behalf of long-term care, and legislators and so the nursing home administrators and the housing managers in those areas are working in smaller mini targeted campaigns to influence legislators about the importance of long-term care. So please, if you get a call from the Weber Johnson folks, please do participate. On the Capitol side of things, the legislative side of things, there have been a few bills being heard this week. The governor actually signed a bill this week that expands medical assistance eligibility to a number of additional people. The estimate is that nearly 87,000 Minnesotans will now have health insurance under medical assistance program, and the governor did sign that this week. We have also been watching a House File 290, Senate File 281, which has to do with the False Claims Act. We worked on that a couple of years ago for you and with you, and there's a bill introduced that has been talked about as federal conformity, but we will be watching that to ensure that it does not have a negative impact on our membership. There have also been some landlord-tenant bills introduced that we're talking with how that would impact our membership, so we'll let you know in our newsletter articles as well on the status of those bills. And when we need to, we'll talk to the authors and talk to different legislators about making changes if necessary. The final bill I'll talk about this week is House File 588, Senate File 471. It has to do with nurse staffing ratios at hospitals. While the bill as drafted does not directly impact long-term care providers in that it would require long-term care providers to have staffing ratios, the bill does require hospitals to have staffing ratios for their registered nurses. We issued a letter from the Long-Term Care Imperative to the author of the legislation, and it was distributed in the committee this morning, which describes that if nurses are required to have staffing standards, we are very concerned about the impact that would have on long-term care providers, because already we're losing a lot of registered nurses to the hospitals. And so we will be watching that bill very closely. It's early in the process, and so there are a number of things that will change on this and the other bills that I mentioned. And so we just want to update you, give you the latest information on what legislators are hearing and what they're talking about. And we will continue to provide you these weekly updates. Please also turn to our weekly newsletter, which comes out on Thursdays. And that's your Inside Scoop. Thank you.